Today, we're going to talk about the real cost of Medicare. First, we'll look at original Medicare. How much will that cost? Second, if you decide to go the Medicare supplement and Part D route, we'll look at that total cost. And then finally, we're going to look at Medicare Advantage plans. What should we budget for that? Let's jump into the video. First, we need to talk about original Medicare, because whether you go with a Medicare supplement or Advantage plan, you still need Part A and Part B with Medicare, and that's called original Medicare. Part A is easy. Usually you've paid into that through payroll taxes your whole life, so it's generally zero premium for most people. In fact, if you elect Social Security, you're probably already automatically enrolled in Part A. If not, you can do that through Social Security or even online through a link below. So that part we have taken care of, zero cost generally for most people. Part B is different. Part B, you have to opt into and pay for a separate premium to Social Security, and that differs depending on your income. Right now, 2025, the standard amount for a Part B premium is $185 per month. Usually that's deducted automatically from Social Security, or you can choose to pay via check, and usually it's done in 3-month installments. So $185 is the average. It can go up from there. You've heard maybe of IRMA, which basically is an adjustment made based on your prior income 2 years before. So if you still have quite a bit of income, your Part B premium can be much higher. In fact, it can be over $600 a month at the highest if you still have significant income from before. Now, you can appeal that with Social Security if your income has changed quite a bit from that point, and we recommend everyone to do that to try to bring that amount down. Otherwise, it'll eventually catch up with you in out years. But for right now, let's go based on $185 a month, which is the average. Reach out to us. We can tell you based on your income what that level is for you. But we'll assume $185 per month is the cost for traditional Medicare. All right, that's one piece. Now, let's look at the Medicare supplement and Part D option, which is kind of like a PPO way to go, and what the cost is there to add to our $185. Medicare supplements. Let's look at that cost and what we expect to budget if that's the direction we want to go. Usually Medicare supplements and Part D, they're purchased together. 2 separate plans, but usually everyone gets them together. We'll assume the G plan, which is by far the most popular plan out there, especially for someone who's new to Medicare at age 65, because you get discounts for the first year, which makes it cheaper than the N plan or other plans. So a G plan is priced based on age and area. That's it. That drives your core cost. So all day long, we run quotes for people based on their zip code and their date of birth, and we show all the major carriers. There are a couple of interesting facets here. First of all, at age 65, you're looking, depending on the area, from around $120 a month to $150 a month. The more expensive areas like LA County will be around $150. We'll use that as an example. We do see some cheaper counties across California, but let's assume $150. What's interesting is that rate will go up as we get older each year. And if you look at the chart, you can see the average discount for the 4 biggest carriers in California that also happen to have discounts for that first year. You notice some interesting things where the cheapest carrier at age 65 probably won't be at 70 and definitely won't be at 75. So we want to re-quote that every year to make sure you're not overpaying for the exact same network and benefits. Otherwise, we can assume around 150. Let's use that as the benchmark. Each year, it goes up a little bit because of inflation. Separate from our age-related increases, that will go up as well. So we'll assume $150 for the Medicare Supplement G plan. Again, let us run your personalized quote for your situation, your area, and we run all the major carriers. Then you're looking at Part D. Part D is interesting right now because we've had a super cheap plan option available each year for the last couple of years. For example, this year there's a plan that's $1.80 from Cigna. Next year, it probably won't be that. It'll be $20, $30. And in fact, going forward, we may see a jump up in Part D, which we talked about, just because of dynamics and pricing and what they're forced to cover now. They're capped at $2,000 that you have to pay, which means the rates are all going to go up starting in 2026. So let's assume 20 to 30 bucks is going to be the cheapest plan going forward. Right now it's $1.80 per month. So altogether, we've got our 185 from traditional Medicare. We have 150-ish for our G plan. That goes up each year. Check with us. And then our Part D plan, we have about 20 bucks. So at age 65, you can safely budget around $350 a month. At age 70, it's probably going to be closer to $400 a month. And at age 75, closer to $450 a month. Based on today's numbers. That's going to change a little bit each year with inflation. Check in with us, but that gives you a good benchmark. Total budget out the door for a G plan with a Part D medication plan added on to traditional Medicare. Aim for $350 up to $450 as we get much older. That's your benchmark on cost if you go that route, which is the most robust in terms of network, in terms of benefits. Now let's look at the advantage side of things. Hey, if this information is helping you, giving you actual information on how you can budget for Medicare, please like and subscribe so we can continue to bring this information to you. Let's get back to the video. All right, advantage plans. How do we budget for that? This gets a little bit different because you still have your Part B premium you have to pay based on your prior income. We talked about that, the 185. That doesn't go away, although we'll talk about later how some advantage plans can reduce that cost. So how do you pay? Because Medicare supplements, you have a premium, then you have very little out of pocket with a G plan on the back end. Advantage plans switch that all around. And that, in most cases, you may have low or zero premium for your actual monthly cost for the plan. So how do you pay? You pay when you get sick or hurt. You have co-pays. You have maybe deductibles. You have amounts you pay that happen as you need healthcare assistance. The key point there is to look at the out-of-pocket maximum. What that says is if I have really big bills over a calendar year or a series of bills, then at what point am I off the hook? When does it go 100% to the carrier if I stay in network, because we have networks with an advantage plan, and I obey the rules? And that's your out-of-pocket max. So if you go into Los Angeles, where it's very populous, super competitive, your max out-of-pocket may be $400, $800 for the year. Meaning if I have hospital runs and stays and medications and all kinds of stuff, when I hit that $400, I'm done. So zero premium, $400 if something big comes up, then I'm done. Now, in other areas where advantage plans aren't as competitive, let's say Bay Area down to San Diego, your out-of-pocket max might be $2,000, $3,000. So there it's a little different. If I know I'm going to have a lot of healthcare costs, then it's not as advantageous to be on that type of a plan if I'm going to hit that max out-of-pocket of a couple grand versus a Medicare supplement. Yes, I'm paying a lot of premium up front, the $150, for example, per month, but I'm basically done on the back end. Advantage is different. So how do we do this? Worst case, you take the $185 a month, you take the max out of pocket, divide that by 12. Let's say it's $800 max out of pocket. It's around $60 a month we can guesstimate. That's your worst case. You're probably not going to hit that because you have to have pretty big bills to get up to that point. But at least you know your worst case in case there's a bad year. That's how we look at advantage plans. So you have very little out of pocket other than co-pays that come up as you use healthcare, your Part B premium at $185. Let's guesstimate around $250 is kind of a good guess, depending on your situation, that we're assuming we're going to hit that max out of pocket or a chunk of it. That's how we can kind of budget advantage plan costs, because there's zero premium generally. It's all on the back end. We're going to nickel and dime things up to that cap. And that's how we do it. We're happy to compare for your situation in your area, the Medicare supplement and the advantage plan, to kind of see what maybe your average budget might be. But we know right off the bat, to wrap up, Original Medicare, 185. Medicare supplement, maybe add another 150 to 170 with your Part D per month. And then Advantage plans, maybe add another 50, worst case, to 100 a month to that 185. That's how we budget for our Medicare costs. These go up a little bit each year. So you want to assume things are going to grow, unfortunately, with inflation. And we're happy to run your current numbers right now to see what the cost is in your situation.